So welcome to the next episode of Health Frontiers. So in these episodes, we used to invite the leaders in healthcare from across the country and abroad. So in this episode, we have with us Madam Dr. Bhavneet Bharti. So she is the director principal of an institute, a medical college, and she's also a professor, a pediatrician in PGI Chandigarh. So welcome, ma'am.
Thank you. Thank you, Dr. Sonu.
So, ma'am, this is, we used to conduct International Public Health Management Development Program. So, Health Frontier is a series under that particular program in which we used to train people from across countries. So, ma'am, because as I told that your journey started as a pediatrician. And I know when I was senior resident, so you used to be like you used to work more on social pediatrics, and you primarily are involved in community and all those things. And now for last I think 4 years, so you have been director principal of a very new medical college which has opened, and I have seen how the development of that medical college has taken place over a very short period of time. So how was the transition? Like how that thing happened? Yeah.
What I can say that definitely my true love is children, and that's how I got into pediatrics. And I really made sure that I get just pediatrics because I find the children innocent, sweet, honest, and I would say that they will never lie. So that's something which really inspires me, and they're full of resilience. If they are unwell, they'll get back soon. And once they're well, they'll give you a smile.
Right.
So which is very unlike of adults. So, in fact, they are my reset buttons. If I have to do something, I have to just see a child and feel energized. So that's about children. And I can say that my journey of being a director is purely accidental. And that I really felt because I'm an alumni of GMC Patiala. And I felt that this is the time to give back.
Right.
And my reason why I joined that institute was probably I will be able to guide the future physicians, and I will be there to set up the foundations. I know sometimes it's difficult once the things are done in a particular way. So here I had that unique opportunity to work totally right from the foundational aspects. So that's something, it was difficult, challenging. However, it was enriching. And I really feel that within a span of 4 years, we've been able to set up a standard which is almost like, as far as the educational standards are concerned, we did one of the validated scales and used it in nearly 400 students. That's almost came like a Manipal. It's a validated international scale. On a dream scale, we asked the students to report our education environment. That's something I feel that we've been able to do. However, there are still many challenges, including infrastructural, manpower, which we are still working on it.
Yeah, ma'am, wonderful to see. And I believe that the people who work with children develop a lot of resilience, develop a lot of empathy, because when you are dealing with children, so you have to be empathetic. And I think all these qualities are actually required by a leader. And I think those innate qualities which you have developed over a period of time, being a professor at PGI in Department of Pediatrics, actually were handy for you to be an effective leader.
Actually, what I realized here is that in our country, we get children when they're in the late adolescence. So when they're 17, 18, some of the children are just 17.
Right.
So they haven't crossed, their prefrontal cortex is still not developed, and they are having all the problems which are there for late adolescents. So here, I've been able to do one project over the last 2 years related to test anxiety, their mental health issues. And I'm happy to report that with just peer-led intervention, where we trained their peers with their seniors, we've been able to have sufficiently reduced anxiety levels. And students are reporting. We had 8 students in a batch of severe anxiety. And at the end of the intervention, severe anxiety was totally gone. So that was really reassuring. And I feel that we need to have that ecosystem to make sure that we are non-judgmental, to create safe spaces, and that is working. And you are right that those qualities we are using, like a benevolent leadership.
Right.
And I have students coming directly to me.
Right.
And approachability, psychological safety, all these things are important, and an emotional leadership with a high EQ. So I think that is really handy for me.
Excellent, ma'am. So leadership with a high EQ is one of the very important skill
Yeah.
which a leader should possess. So, ma'am, in this less than 4 years or so, you have developed a college which was just in inception.
Yeah.
You have just started with a brick, and now you have told that it is matching one of the best medical colleges in the country.
Yeah.
So, what do you feel that what leadership skills are actually required for being a effective leader?
I think one of the most important is, I feel you have to be authentic.
Mhm.
That's more important. I think people, children, they're all judging you.
Right.
They're all seeing you,
Right.
how you are. You have to be honest. You have difficulties, I understand. I acknowledge, I tell them. And you have to have a collaborative approach. They should be partners in whatever we do. It has to be, wherever the team building is not there, it doesn't work.
Mhm.
So I feel that when you do build a team, sometimes at the cost of difficulties, still, whenever you take her psychological safety, allowing them to speak, I think that really works well. And I believe that has been my main strength, that I had a lot of transparency, telling everybody. And somebody told me, like, when Steve Jobs was working, we had almost daily meetings.
Mhm.
So to the extent they became a little toxic towards the end, that time I had to decrease and I had to pass on the legacy again. Now is the time that I have to be giving back the community and have people do it, give the legacy and move forward.
Right. And I think you have spoken very wonderful words, which people, the leaders used to say, that authentic, honesty or transparency is really, really important
Yeah.
for being an effective leader.
Yeah.
And the teamwork and approachability. Because sometimes, when people becomes in a position of chair, so sometimes the approachability with the faculty, with the students is missing. And
Yeah.
that's why there is a communication barriers.
I tell them, I haven't put my nameplate there in my college, because I say I am also serving, but serving in a different role. So
Right.
till 4 years, I don't have a personal assistant. Now it is becoming difficult, but definitely for the beginning years, we have to be approachable, because we don't know whether we are in the right. We need inputs from various stakeholders. So that was important. In fact, we were not having a typical, it was like a flat hierarchy.
Mhm.
And to begin with, it's something like that only. It's only later on that you have to have that hierarchical models and others, and like an assembly line you have to work.
Right.
But for a beginning of the institute, I think it's important to have flat hierarchy.
So this is, I think, for audience, this is situational leadership. So, ma'am was when she started with a medical college with a small handful of faculty members with just 1 or 2 batches. So then she started with the flat approach without
In fact,
much.
no students. I just single-handedly started.
Wow.
And now it's 400 students, 4 batches, and we have PGs in almost 6-7 of the subjects.
Right.
So that's also started.
Right. Great. So over a period of time, ma'am has, I think when the things have grown up, so she has started giving some responsibilities, authorities to people down under.
Yeah,
because
delegation, obviously. They say that delegation has to be done.
Has to be done. Over a period of time, you have done that. And again, I feel, because I went to your college once there, so the faculty was so confidently and so they were so approachable.
Yeah.
And you are so approachable to them. So it was very good, actually, looking at a director and very approachable to the people.
Actually, if you are new, you can do innovations. So what we did when you had come, we had that mock parliament, because
Exactly.
I felt that community medicine, sometimes it has to be made more immersive experiences. And then at that time, I was very happy that students really learned that aspect of community medicine.
And again, I think for listeners, this is really important, because just don't lose the thing innovation. Because when a leader, so they just go on doing the things which are mundane, which are going on, which are repetitive, which are going on for the past many years. And this is not leadership. So just innovate something, do something new, which you feel that has not been done, and contribute to the society. So I think this is what, ma'am, you have done. So, ma'am, in this entire period, because I can understand that from a brick to a big medical college, and with so many students who are considered soul of the entire hospital, so you might have faced some challenges. And I will not talk about the infrastructural challenges right now. I'll talk about something related to human.
the most difficult challenge I find is emotion which I find difficult to handle is jealousy. That's the most difficult which I felt. And but how I helped like I was doing a women leadership course, and I told that how I handle this situation is that I start thinking lovingly about that person. So when I start thinking about lovingly and I think, okay, I am sorry, thank you, this. So she said, see, this what you did is something in the Hawaiian philosophy, Ho'oponopono. That Hawaiian philosophy talks about that you never ever meet, but you say you're thankful, you are grateful, you are sorry. So that really helped me, because I said, we were talking about conflicts today. So not getting into conflicts, understanding their perspectives, usually the things settle down on their own. So giving them space to people. So jealousy was the single most emotion I found it very difficult to handle.
Yeah.
Rest of the things
and I think very nice approach, because when all these negative emotions, which we call jealousy, fear, and all those things, so we don't go behind the scene. So we don't normally go behind the scene. We see that the person is behaving like that. So we see the person, not their behavior. So I think you have got hold of those behavior and the root cause of their behavior, and that understanding has helped you in managing that negative emotions.
Yeah, another thing was that our hospital is under the scheme where the center state scheme was there, where it was with the district hospitals, and to integrate the two was very difficult. There I had to teach them that we don't have a concept of othering. We are working for the same government. We are working for the same patients.
Right.
So let's go as a team.
Right.
So that's more important.
Very good, ma'am. I think you have re-emphasized upon the teamwork and giving responsibility to people, empowerment, and all those things, which are really important for a person who have come across. And I have witnessed the health parliament which you have conducted. It was a very new concept for me as well. And every student were behaving like they were leaders.
Yeah.
So I think that's a wonderful, and you are inculcating those leadership skills in the students as well. And this is one of the quality of a leader. So leader begets more leaders. It's not leader begets more followers. Yes. Yeah. So ma'am, lastly, because people have a myth, or what I can say, a misconception that the clinicians are meant for just patient work. And leadership and management is nothing to do with them. So do you think in hospitals, when we are doing some clinical duties for clinicians, is it important, leadership and management? I
think leadership starts right from beginning. It's not about clinicians or non-clinicians. Wherever, whatever we are doing, we need to understand the leadership skills. I think if they don't understand, they don't see it as a phenomenon. They get into more conflicts because of that. So I feel when we're talking about conflict, we're talking about leadership styles. In fact, everyone must be groomed into this. I know there are some natural leaders.
Yeah.
That's quite all right. But some skills we must have. So that's irrespective of whether you're a specialty, administration, anything you are. You must have those skills.
And we have a lot of anecdotes for it. Like if a doctor is talking nicely to a patient, so that satisfaction level actually increases many folds.
Definitely.
So teamwork, and again, it's very important, because not only conflicts, but also a lot of other things which happen between interactions. Yeah, so that is important. So ma'am, we have started this International Public Health Management Development Program for last 10 years now. We initiated with a national course initially, and thereafter, just in period of 7-8 months, it turns international, and now people from across countries are coming here to be trained. So do you think the Government of India, ITEC, Ministry of External Affairs, has done a right job in giving PGI this responsibility?
I think it's an excellent thing. And PGI is one of the centers of excellence. And having the participants from across the world, I think it's a wonderful initiative. And even I'm enriched in these few sessions where I have joined them. It's lovely. In fact, I was sharing with them my visit to Africa and how I was enriched with my visit to Africa and continent. And obviously, we developed that diversity, inclusivity, that tolerance, that also is, and the basic humanity is same. So I think it's a wonderful initiative, and we should continue such activities, which is in the interest of the whole world that we should be meeting, and a global peace which should come with these activities. studies.
And ma'am, last question is, because you have come now for the second time, I guess, in this program.
Yeah.
So you have witnessed some of the things which are different from other programs. So what things you find it different in this program?
So one is, it's not didactic lectures. I think you emphasize rightly that it has to be activities. It has to be there has to be gamifications. They should feel empowered. A lot of rewards which are there.
Correct.
I think it's really a good idea to have it in that manner, which everybody starts enjoying when they have it like that.
Exactly, ma'am. And over a period of time, we have also evolved, because every course is a new course. This is the 29th program. So every program we see how we can involve them much. And now we have just 2 lectures in entire 8 hours, and rest of them are games, case studies, and
so that's an excellent. I think that's an excellent, and specifically when we have adult learners.
Exactly,
so
exactly, ma'am.
We must have like that.
And we have peer-to-peer learning. They also share their case studies. Even we learn from them that how they have dealt the situations in their own hospitals, in their own country.
In their own country. Wonderful, wonderful.
Right. So, ma'am, thank you very much for coming here and for being part of this Health Frontiers. And we look forward to meeting you again, ma'am, and enriching from your vast experience in leadership and public health.
Thank you.
Thank you, ma'am.
Thank you.
Thank you.
Excellent.